citizens of the United States have certain rights. For example, we have the right to vote, we have the right to worship as we would like, we have the right to free speech. These rights are all guaranteed by the Constitution of the United States as well as the Bill of Rights. Healthcare consumers as well have certain rights that enable them to receive the highest quality of care possible. Hi, I'm Kathy Getrust, and I'm an instructor in community health, and today we're going to be talking about client rights. Anybody entering the healthcare system will receive a copy of a rights document. The particular form varies depending on the kind of institution that they access, and I will talk about several different kinds. The first is one called the resident rights. This is a document that is provided to anyone that's entering a skilled facility such as a nursing home. These rights were legislated by the federal government by the Omnibus Reconciliation Act of 1987, also called OBRA. The resident on admission to a nursing home must sign the document that they understand and have received their rights document, this resident rights. In addition, if a person enters into a hospital situation, they are given what's called a patient Bill of Rights. This was developed by the American Hospital Association and again is given to any person upon admission. And if the individual is unable to comprehend the form, whatever kind of document, rights document is received, then the family receives the information about the rights that the individual has during their health care stay. A third kind of rights document is called the client rights. This is a particular rights document that's used for any individual that's going to be receiving home health treatment. Regardless of the kind of rights document that might be seen, all healthcare workers have responsibilities relative to these patient rights. First of all, it's a professional nurse's responsibility or other designated individual to see that on admission to the healthcare facility, the individual has received a copy of the rights that's appropriate to that setting. All of us working in a healthcare setting must be knowledgeable about the rights document that is utilized in our facility, and if you are not provided a copy of that on your orientation to your new facility, please ask to see it and become very familiar with what it has to say. Supporting the rights of healthcare consumers contributes to effective patient care. Just as your employer may not discriminate in hiring practices, you may not discriminate, nor can I or any others, in the services and care that's provided to residents with vastly different backgrounds. Some may have different ethnic backgrounds, such as Asian American, African American, Hispanic, those that have different religious backgrounds, as well as those with varying economic backgrounds. Regardless of whether a patient is wealthy or if they're receiving public or state assistance, they must all receive equally quality care. Violation of patient rights is punishable by law, so all the rights of individuals must be adhered to. I'm going to be providing an overview of certain rights that are common to any of the rights documents, regardless of whether the patient might be admitted to a nursing home, to a hospital, or to a home health agency. But just remember that this is only a sampling of the rights, and it's your responsibility to become familiar with the particular rights documents that's used in your setting. The first is probably the cornerstone of all the rights, and that is the right to be treated with dignity, respect, and full recognition of one's individuality. That means that we need to respect all cultures and nationalities, and we need to be respectful of them as an individual. It would certainly be inappropriate to be demeaning to an individual, to talk down to someone, make fun of their disoriented status. We also, in a past experience, I worked in a long-term care facility where the caregivers enjoyed dressing the patients up. And there's nothing wrong with having residents look their finest, but it got to be a competition whereby some caregivers were overextending, probably crossing the line as far as what was appropriate. There was an excessive amount of makeup that was put on the individuals, gaudy jewelry, and by the time they were finished, some of the residents looked rather clownish in appearance, and so that certainly would not have shown respect for their dignity and needed to be stopped. Another is the right to be treated, the right to privacy. That means that any treatments or care of personal needs to be done in a private area. That means the curtain needs to be pulled around their bed. That means bath blanket needs to be used for bathing. That the bathroom door needs to be closed when the patient is using it. Privacy also in phone conversation. If a resident receives a phone call, it's your responsibility to excuse yourself so that individual can carry on a conversation in private. Also, the important thing is knocking before entering a patient room. Most of the time I see people knocking, but they're knocking on the door as they're entering, as opposed to knocking, pausing, and waiting for the individual to maybe cover themselves up or whatever might be needed before entering. Think about how you would feel in your home setting if someone knocked on your door or rang your doorbell, and as they were doing so, they were also entering your home. I think that we would find that highly inappropriate and an invasion of privacy, and so too it is for our residents. Confidentiality is another right. Information seen on records and heard about patients is considered privileged information, and this is information that the patient's spouse and family members even may not be aware of. Confidentiality must be kept, and so never discuss anything with anyone other than on a need-to-know basis, and generally that's the individuals on the care team. With privilege comes responsibility, and so it's important not to discuss anything outside of that core team. That means no discussion in the hallways of patients' cares or their names, no discussion in the elevator about specific patients, in the break room, cafeteria, or in your home setting. The United States Congress and the United States Department of Health and Human